Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. We are discussing imaging of immunocompromised patient. Basically, this patient had carcinoma of the anorectal region. We can see abnormal growth is appreciated in anorectal area with perirectal nodularity and infiltration, suggesting extension of the disease to its surroundings. And for this patient had colostomy. So here we can see colon in anterior abdominal wall on left side. After surgery, patient was advised for the chemotherapy and he completed chemotherapy. And after completing chemotherapy, patient developed fever and he was asked for CT of the chest, abdomen and pelvis. Here we can see this is CT chest where both lungs, mediastinum are normal. These are the chronal images. Here we can see CT abdomen with IV contrast. We can see liver shows normal homogeneous parenchymal density. Same is with spleen, but spleen is a bit prominent in size. Gallbladder is smooth-walled and appears normal with normal pancreas. There is mild hydronephrosis in both kidneys, while we can see few collections are noted in left psoas muscle in these slices. Here we have images with bone window setting. We can see dorsolumbosacral region, pelvic bones, hip joints, and there is no metastatic focus in axial skeleton, including hip bones. Degenerative changes are noted at L5S1 level, where we can see there is reduction in the height of L5S1 disc with sclerosis suggesting degenerative process, while similar degenerative changes are also appreciated in both hip joints, where we can see reduction in the height of the joint space in weight bearing area with osteophyte formation. And so prominent degenerative changes are noted in lumbosacral junction and in both hip joints, and there is no CT evidence of any metastatic disease in the bones. Solid viscera appears unremarkable except mild hydronephrosis in both kidneys and small collection in the left psoas region, while both lung fields are clear as well. Here we can see that there is oval shaped collection near the shoulder joint in subscapularis muscle. Here we have chronal images where we can see there is mild bilateral hydronephrosis and prominent sized collections are noted in psoas muscle and iliacus muscle. Here we can see collection in the right psoas and iliacus muscle. This is iliopsoas in the region of its attachment on the femur. Entire course of the left psoas muscle full of collection. Here we can see down to its bony attachment on femur. So prominent iliopsoas collection on left side, while collection is also noted on right side as well. Mild bilateral hydronephrosis and collection is noted in right gluteal area and right posterior paraspinal muscles, both on chronal and axial images. Here multiple collections are noted in right iliopsoas area and prominent collection is noted on left side. Here we can see colostomy in left lower abdomen. Same example, gluteal muscles with collection and collection in the left iliopsoas area. small collection in the right iliacus and right psoas muscle, while we can also see presacral space contain abscess as well. So after chemotherapy, this patient developed fever, and this fever was because of multifocal abscesses predominantly involving iliopsoas region, gluteal region, and an area around left shoulder, while solid abdominal viscera, bones and lungs were unremarkable without having any evidence of metastatic disease. However, we can see mild bilateral hydronephrosis because of inflammatory changes around lower ureters, which are associated with iliopsoas abscesses. Unibladder is unremarkable. Thank you very much. Assalamu alaikum wa rahmatullah.